Hello friends, Namaskar, welcome back to my YouTube channel. Now medicine is not just about hospitals, prescriptions or machines. At its heart, medicine is about stories of pain, feeling, of fear and hope and our fragile humanity. Today I want to share with you 5 extraordinary books that bring these stories alive, that bring these stories to life. You don't have to be a doctor to read these books. You just have to be human and have a human understanding. These 5 books will take you to the inner world of medical science, to the inner world of doctors, patients, and the interrelationship between them, and also a larger world that they are a part of, how we navigate through the challenges of everyday life. The first book I'll be telling about in this series is Differential Diagnosis by Leah Kaminsky. Now, differential diagnosis is a term that we often use when we look at a patient and make a series of possible diagnoses that this could be the diagnosis in that patient. But this book is not about differential diagnosis from a clinical point of view. This book is vaguely termed as differential diagnosis to put into perspective the different challenges that a doctor, patient and the interrelationship or the whole medical science faces while finding a solution to a problem medically and also psychological and emotionally. Here, Kaminsky is both a physician and a storyteller. She invites us to a doctor's mind where every symptom is a clue and every patient is a mystery. But what makes this book a powerful read is not just science alone. It is a reminder that healing is not just something that begins with technology, but it begins with compassion. The book has very interesting lines. One of the very interesting things about this book is when it says a physician works at the border between science and soul. So many things have changed over the years in terms of our understanding of physiology, of our understanding of the microbiology, of pathology of diseases, and our approach towards finding a cure as far as our understanding of pharmacology is concerned. Our diagnostic ability, starting from routine blood tests to advanced MRI scans or genetic testing, has remarkably changed the spectrum of medicine. But what has not changed over the millennia is the human soul. The role of a physician as healer has not fundamentally changed by this burgeoning of knowledge. Greater knowledge doesn't always translate into greater wisdom. Wisdom requires melding information with judgment and values. So here is the story, as the writer puts it. This remarkable collection melds science and knowledge. This remarkable collection melds science and the soul, logic with feeling, knowledge with wisdom. The voices that the reader hears are among the most prominent in the constellation of physician writers. So, find your time to read this wonderful narration, Differential Diagnosis. Some other time I'll come and have a separate narration and review of this book. In a world rushing to scan, test, measure, this book teaches us the forgotten art of listening and the forgotten art of connecting with other human beings, be it a doctor, physician, be it in between our common day-to-day life. The second book is a wonderful book by Atul Gawande. Now, Atul Gawande is an Indian-American surgeon, but apart from being a surgeon, he is a wonderful writer. He has a philosophical aspect into his writing. And in this book, Being Mortal, he takes us to the very age of life. Now, Being Mortal is not just a book about death. It is about what makes life worth living, even at the very fragile end. This book actually whispers a wonderful truth we often ignore, that medicine should not only be about fighting for the number of days, fighting for more days into our life, or in other words, medicine should be a struggle or striving towards infusing life into those days. And it is a book that will stay with you long after you turn the last page, because it speaks to you something that is universal, our search for meaning when time is sought. So the next book is a checklist manifesto by the same author, Atul Gawande. Here, Gawande changes his voice from that of a philosopher to a pragmatist. The checklist manifesto is a celebration of simplicity in a world that's drowning in complexity. This book actually derives its concept from the aviation industry, where the pilots, before starting a plane, have to follow a set of maneuvers, and these maneuvers are recorded in the form of a checklist to minimize errors in aviation industry, to minimize the incidence of adverse events in aviation industry. A checklist was designed, and later on it was found that this checklist cannot just be confined to the aviation industry. It has wider ramifications, wider use, and especially in the field of medicine, especially in the critical care setting. To minimize infections, to minimize complications, the checklist can be a wonderful tool, and the same can be expanded to other areas of life. A checklist so humble, so simple, yet it can be a powerful tool as far as our ability to understand and simplify or reduce the complexities out of complicated tasks and make them simple, make them accessible, and make them successful as far as our approach towards a certain task is concerned. So sometimes order begins with a single tick box in the form of a checklist. The fourth in the segment is a book that's one of my own favorites, and that book is Spillover. Spillover by David Quammen. David Quammen is a science journalist, but in this book he almost turns into an investigative journalist. This book, Spillover, is about animal infections and the next human pandemic. Interestingly, this book was written just before COVID-19 pandemic, and after the COVID-19 pandemic, this book has renewed significance. This book speaks about zoonosis. Now, zoonosis are diseases that are starting from animal infections and transmissible to humans. The most famous zoonosis before COVID-19 pandemic, of course, was acquired immunodeficiency syndrome, or AIDS, and pondering them as a group tends to reaffirm the old Darwinian truth that humanity is a kind of animal inextricably connected with other animals in origin, in descent, in sickness, and in health. So don't forget to read this book, one of my favorites, one of a thrilling reads, and books in this genre are going to be very, very interesting, because we are living in a world of zoonosis. Our constant interaction between animals and humans is increasing day by day, and there are certain countries where exotic animals and rare animals are the interaction between humans and rare animals are also increasing, and so is the scope of zoonosis. We never know when next zoonosis is lurking large and when it might come and invade a human civilization once again, as just the COVID-19 pandemic that can spell a doom for the entire humanity for some possible time. The last book in this segment is Emperor of Maladies by Siddharth Mukherjee. Now, Siddharth Mukherjee is another Indian-American writer. He is an oncologist based in America. He has a series of books, but this book made him the most overnight sensation. This is a Pulitzer Prize owner. This book has its own set of followers and fans, and this book is a masterpiece, what Siddharth Mukherjee himself calls as a biography of cancer. Now, cancer is a disease of body's own cells wrenched from their normal rules of growth. Now, this is not just a book about medical history. It's an epic filled with human triumphs and heartbreaks. It's so cancer is not just an abstract enemy, but as a shadow that has lived alongside humanity for centuries. Yet, it is a book not just about disease, not about despair, but it's a book about hope. It's a book about how our knowledge, our persistence, our understanding, our courage can push back against the darkest of adversaries. And that's what we are seeing in everyday life, as we are finding more and more tools to find this dangerous adversary. Well, these 5 books I believe taking a cue from my presentation or my review today, you might find one of these books or all these books interesting. So let me know which one of these volumes you are going to read first. These books will give you a window into the wonderful insight into the soul of medicine. They remind us that medicine is not just about curing diseases. It is about understanding what it means to live, what it means to suffer, and what it means to endure, and how the knowledge gained from medical science can be applied to every other area of life to reduce complexities and increase the rate of success in day-to-day life. So whether you are a doctor or not, these stories belong to you. So thank you once again for listening to this review and tuning into my channel. If you think these books have touched your heart and you believe others need to know these wonderful stories hidden in these books, do like, share and subscribe. Share more and more people so that they can come and understand about these books. For more such, I'll come again in my next episode. Till then, stay safe, stay happy. Goodbye, take care, namaskar.